Well, good afternoon, everybody, and welcome to today's Lunch and Learn session. Today's session is going to be brought to you by Adam, who is the NIHR Wikipedian in residence. So I'm going to hand over to him now. If you've got any questions or anything, feel free to put them in the chat and we will have a bit of a question and answer session at the end. And if you could keep yourselves on mute, if possible, just so that there's no background noise or anything, that'd be great. Thank you. Over to you, Adam.
Thank you very much. And hi, everyone. And thanks for your interest in this topic. I'll just share my screen quickly. Yes, it should be working now. Also, apologies. I think I'll be kind of sweating a lot because I'm coming in from Hungary where there's a heat warning for the whole week. So I'll just be quietly melting away at the same time, but don't worry about that. So thank you very much. My name is Adam Harangozó, and I work as the Wikipedian in residence at the NIHR, more specifically the NIHR Coordinating Center. What does this all mean? What is this position? I'll tell you all about it. How I would like to kind of structure today's webinar is that I'll be talking a bit about what Wikipedia is in general, how it works, what we know about its relation to medical information, health information, why it's important for that, and then tell you more about my role, what we do at the NIHR, and how we can work together if you're interested in using Wikipedia for dissemination. What I wanted to say is that I'm aware of the kind of anxiety or preconceptions around Wikipedia, and that is, totally legitimate, of course. I hope that I can show you that Wikipedia is actually quite different from its reputation, but I would be very happy to hear in the end what you think, any kind of criticism that you have about Wikipedia, any kind of thoughts. So feel free to share. So really just to start from the beginning, what is Wikipedia? Wikipedia is an encyclopedia, so that is a genre of its own. What it aims to do is to summarize high quality sources that are already out there, already published, and summarize them in a way that is not for a specialist audience, but for a wider audience. So to summarize it in an accessible, plain language as much as possible. And this is kind of one of the anxieties or the issues around Wikipedia, that people think that it's going to be the ultimate kind of point of knowledge for most people, or the source for PhDs. Wikipedia itself states that it aims to be a starting point for learning about a topic, about a concept, and then it provides links to further reliable sources. This is the kind of idea or the theory. It is important to know, especially in medical information, that even if it aims to be this, it's still gonna be the first and only place where a lot of people look for information. So it matters what they find there. A bit more background on Wikipedia. Wikipedia is run by a non-profit organization called the Wikimedia Foundation. They don't rely on ads or registration fees. Wikipedia is free to use. They work from grants and crowdsourcing. And also Wikipedia is not only free to use, but all the content and images that you see there is under an open copyright. So it's also free to reuse in other contexts. Of course, you need to provide the kind of source or where the information comes from. I think this is the main kind of site of worries around Wikipedia, that anyone can edit Wikipedia. You just go there and change whatever you want. I'll show you that this is more complicated than it seems. At the same time, it's true, Wikipedia can be edited by anyone. You don't need to register, even you can just go there and edit Wikipedia, but we'll talk more about this. We'll be focusing on the English Wikipedia, but it's important to know that there are Wikipedias in more than 300 languages, which are all interconnected. These are not kind of direct translations of the English Wikipedia. Each language has their own editorial community their own content. Of course, they can decide to translate from other Wikipedias, but in theory, they decide what they want. This is, for example, very important in the context of global health. So translating health information to reach audiences whose native language is not English necessarily, but obviously English Wikipedia is the largest, and that's what we work with the most. So that's what I'll be focusing on. So what we know about English Wikipedia is that it's one of the most visited websites in the world. Each month, the articles on English Wikipedia are viewed 10 billion times. Obviously, that doesn't mean 10 billion people, but still, you can see kind of the popularity of this website. Obviously, most viewers or visitors come from the States, but the UK, India, and Canada are also like in the top countries. And of course, many other countries that have their own language Wikipedias still visit the English language Wikipedia because of the sheer number of editors, it has more content and perhaps better quality content. So if we look at specifically at medical health related articles on Wikipedia, what we know is that each month it is viewed, these articles are viewed more than 100 million times. Actually, this is only for the top 1,000 medical articles, but I think you get the kind of importance. So what we can confidently say is that Wikipedia is one of the most important, if not the most important resources for health information on the internet. It is where people go to find out about any kind of related topics. What we know about medical articles is that there are around 50,000 articles that are relevant directly or indirectly to medicine and health on Wikipedia. If we think about the audience, I like to emphasize that Wikipedia is for a general audience. So also the medical articles are not for medical professionals, but for anyone who wants to find out anything about medical topics. At the same time, we know that around 50 to 70% of medical professionals also use Wikipedia for medical information. This data actually comes from the UK. I don't know if the numbers are the same or similar for other countries, but I wouldn't be surprised if it's around the same kind of percentage. And we also know that it's one of the top sites for medical students for health information. So, of course, we should never forget that it's for a lay audience. We can also reach more kind of specific audiences through Wikipedia. What we know about the medical content on Wikipedia, the medical articles, that they are in general high quality, they are reliable, they don't contain misinformation or any kind of false data. There are various studies looking at these, specifically the medical articles on English Wikipedia. So this is kind of established that it is a high quality, good source for medical information. At the same time, what we also know is that these articles contain omissions, so there are important aspects missing. They're not necessarily up to date. There are even articles where the sources are 5-10 years old, so they don't have the most up-to-date information. And my pet peeve is that they're not written in an accessible language very often. They're difficult to read. There are studies that pointed out that the kind of average reading level of health articles on Wikipedia is a university reading level. So even though it's meant for a wider audience, I would say that most people would have difficulties kind of understanding the information that's there. So these are the kind of problems with these articles. Again, just to emphasize the importance of Wikipedia for medical information, what you can see here are the daily page views for the article on monkeypox, and the time frame is of the recent outbreak. So you can see when news came out of monkeypox outbreak, a large number of people immediately went to Wikipedia to find out about what this whole thing is. and yeah, what it means. And you can see the same kind of graphs for COVID as well. You can see the different waves of COVID and how people went for information to Wikipedia. So we really know it is the first place where and yeah, the most visited place where people go for information. So as I mentioned, it is true that Wikipedia can be edited by anyone, but that doesn't mean that you can just go on Wikipedia and change anything according to whatever you think. It is a lot more complex than that, and there are actually quite rigorous policies making sure that Wikipedia stays reliable. I just want to show you a few of these core policies. So the first one is neutral point of view, because this is an encyclopedia.
Hi, Adam.
Yes.
Really, really sorry to interrupt. I don't think our slides are moving across. The last page I can see is the medical articles page views. I'm not quite sure if we've moved on from the slides.
I'll just stop sharing and then I'll try again. Just a second. Thank you for letting me know. So how about now?
Yeah, that's the monkeypox graph. Yeah, that's moving along.
Thank you.
Perfect.
So this
Thank
was
you.
about the kind of daily page use for the monkeypox article, as I mentioned, and to talk more about the policies around editing Wikipedia. And please do let me know if they freeze again. So these are the kind of core policies that ensure that Wikipedia stays reliable and high quality. First is called neutral point of view, because we're writing an encyclopedia. We need to write in an objective, factual tone, summarize the facts, the knowledge that are already out there. Perhaps the most important one is verifiability, which means that whatever you put on Wikipedia needs to come with a reference to a reliable source, so other editors, readers can check where this information comes from, if that information is really the same in the original source. Reliable sources might sound vague, but it's quite well defined on Wikipedia. In short, it's peer-reviewed, indexed academic journals, academic textbooks. I like to kind of point out that perhaps Wikipedia is the only really large platform that asks people to cite their sources and ask them not to kind of provide information without referencing the source. I think that it actually is very important. The third one is no original research. That might sound strange. What it means, originally this was kind of developed to ask people not to include their own theories about how the world works, sometimes also known as conspiracy theories, and just use information that is already published, that is already out there. But it's also important for researchers. So even if you are in the middle of a research and you think you're quite sure about something, you can only add information that comes from already published sources. And also you cannot interpret the importance, the weight of these sources. We'll talk a bit about this at the end. But yeah, so you can only work from the kind of text that is published, that is in the article. Just quickly about so beyond these policies, Wikipedia employs various other strategies to make sure that it stays free of misinformation. So for example, people can add articles to their watch list, which means that they get an email or a notification if a single letter is changed in this article. And I think, for example, the COVID-19 article is in the watch list of 20,000 people who immediately get notified if anything is changed, and then of course they go and they look at it and they interfere if this is kind of any kind of bad-willed editing. And there are kind of automated software also working, so bots that automatically remove vandalism and spam. So this is quite a robust system, and of course is based not just on bots, but the number of editors looking at these articles. If an article is contested or very popular in the sense that many people want to edit it, so for example, COVID, because it's just so topical, it's also possible to limit the number of people who can edit it. So for example, they can say that people who have been registered for more than 2 months can edit this article, or who had edited more than 500 articles. So this kind of limits who can edit these articles. And of course, as a kind of last solution, Wikipedia can also ban people from editing articles to make sure that they don't cause any kind of negative effects. But really what we know and what studies have pointed out in Wikipedia is that medical articles manage to keep free of disinformation. There is actually a very interesting study on how the kind of dynamics of the COVID-19 article during the pandemic and how editors worked on making sure that it's free of misinformation, but also that it works with the most up-to-date sources. So what is a Wikipedian in residence? The role I'm employed in. This is a role originally started by cultural institutions, actually galleries, museums, archives, libraries, to help them share the cultural heritage that they keep and that they work with, to share this with a wider audience of Wikipedia. But in the recent years, recent 5 years, more research-oriented institutions also employed this role. You can see some of them in the slide. Basically, this role, or I am a kind of facilitator between the worlds of Wikipedia and the worlds of academia or research or a specific institution, to make sure that researchers can share information and evidence in a way that is, a smooth process and works for both the kind of policies of Wikipedia and the institution. But still, it is, I would say, still kind of an experimental role. It's new for the NIHR, but also not many countries beyond the English-speaking world have this role in research institutions, and not many also in the English-speaking world. So this is something that we're really still exploring. So what I do in this role, the main goal is to improve Wikipedia articles and add NIHR-funded NIHR-funded research evidence. You can see some of the articles that we've worked on, how many words we've added and the references, and how many people viewed these articles after we've edited them. As you can see, it's really kind of depends on the centrality of the topic. So there are obviously topics that will, like multimorbidity or multiple long-term conditions, that will get less views because they're less known by the public. But what does it mean to edit Wikipedia? Or what does it mean to add something to Wikipedia? On the most basic level, it means summarizing a single research paper and adding it, summarizing it as a paragraph, hopefully in an accessible language, and adding it to the relevant Wikipedia articles wherever they fit. So this is really the kind of basic level. Of course, you can use more than just a single paper. So for example, the article on cancer screening lacked any information about the obstacles and issues around attending these screenings. So we used a bunch of papers to create a whole new section about attendance to these screenings. The main kind of activity that I do in this position is what I call workshops, where we invite a group of researchers or multiple groups from different institutions around the NIHR or beyond the NIHR, and we focus on a single article that corresponds to what they research, and we thoroughly rewrite, improve, and update this article. So here we were working with researchers who focus on antimicrobial resistance. And as you can see, the green parts are the new information that we've added, the red ones, what we've removed. This is really just to illustrate that we looked at the whole article as a text and not just put small summaries of single papers, but we made sure that the whole article is up to date and a good source of information about this topic. And these are really impactful ways of disseminating research, I believe. So I created this kind of, well, not a word cloud, but just like images about Wikipedia articles that that exist, that are already out there, which are relevant to your ARC's research. I hope I got it right. Apologies if anything that's very important or very obvious is missing. Really, I just wanted to show you that there are a variety of articles that are relevant to your research, and also that a single research paper or research papers can be actually relevant to multiple articles that are around the same topic. So I think there was a study about behavior activation for older people in social isolation through telephone. So you can see on the right side that is actually relevant for 3 articles. That just means that you can reach people on Wikipedia through multiple articles, so they might not necessarily read the behavioral activation article, but the social isolation article. We can still reach them and put the evidence, where they're looking for it. Yeah. So to finish up, there are various opportunities to collaborate with me or with this project of the NIHR. Obviously, to emphasize, this doesn't come with any extra fees or whatever. This is a service of the NIHR, a project that we're doing with the long-term goal of seeing how we can integrate Wikipedia to dissemination. So we can do various things. Maybe the first one is less relevant, but still the kind of webinar that I'm doing now, introducing Wikipedia to smaller or larger teams, if it's necessary, if there are any kind of preconceptions that need to be addressed, or just in general as a first step. The main kind of, as I said, the main activity are these workshops. So focusing on a specific article and adding, well, your research, but also more research, whatever is missing from these articles. And these can be used, for example, to network with other teams or other researchers. This usually works with 20, 30 people. And these workshops are, how they work is that they're in general 1 hour long. And I don't teach how to edit Wikipedia directly. So for the sake of it being easy and simple, we're working with a Google document version of the specific Wikipedia article. So it's just like a collaborative text writing. And when we're finished and we all agreed that this is good to go, then I do the editing on Wikipedia. At the same time, after this, if anyone is interested in learning actually how to edit Wikipedia, spoiler alert, it is very simple and very straightforward. I'm very happy to teach anybody how to edit Wikipedia. And as the goal of this whole project, we can also discuss how we can, if you're interested, how to integrate Wikipedia in the kind of dissemination practices of your ARC or of your teams. So this really aims to be a long-term project. So I know I sometimes sound like a Wikipedia salesman, saying that Wikipedia is the most wonderful thing on earth. It's not. It's a model that's really seems to be working, and whatever we think about it, is just visited by such a number of people that it's important to have some kind of relation to it, and I believe that an active contributing relation is the most useful. But of course, there are various problems around Wikipedia. It's not a utopian society of editors that edit it. Important note, when I say Wikipedia editors, that just means anyone who edits Wikipedia. So there is not a paid editorial board for Wikipedia. Of course, there are people who have been editing it for longer, but still anyone can become an editor. So there is a kind of sexism, racism, and whatever you can imagine around the interactions of editors. This is not very widespread, and the foundation behind Wikipedia is very aware of this, and they're doing various projects to address these problematic behaviors, and Wikipedia has policies around communication and being civilized. But just to emphasize that, obviously, it does recreate real world or real societies, sadly, in a way. So it's not perfect. Furthermore, specifically from your perspective, there are a few well, caveats or things that make it more difficult or complex to contribute to Wikipedia. So first of all, I hope you're already excited to add your own research to Wikipedia, and that is fine. Please, if you have this excitement, don't lose it. At the same time, there's a policy on Wikipedia that asks us to prefer secondary research, so systematic reviews, meta-analysis, as the sources that we work from. Obviously, this is based on evidence-based medicine, but also the idea is that primary research can be refuted, new evidence can change the findings, the weight and importance of the findings is not established. So in a way, this is a slower kind of like adding of information, waiting until there is a review looking at the available information. I would approach this two ways. First is that if you, for some reason, cannot add your own research because it's primary research, still you can update the Wikipedia article using secondary research to, in a way, bring it up to date about the topic that you're researching, and in a way prepare the article for adding your research whenever that's possible. But also, please don't think that if you're working on primary research that it's not going to be possible to add to Wikipedia, but because there is flexibility in these policies. So if you can make the case that this research is so important, so new, so impactful, that we can also work with it. But it's just important to keep in mind that secondary research is the preferred reference or source on Wikipedia. Wrong direction. This is also, so yes. So when we edit Wikipedia, we cannot promote an institution, researchers, or a specific research paper. We really kind of, in a dry way, summarize the evidence, the findings of these papers. And then, of course, people can see where this information comes from in the reference, but we're not going to be able to say that the NIHR, this NIHR funded study by NIHR, which is the greatest research institution in the UK, found this and this and this by a number of wonderful researchers. So really, it's not for promotion, but really disseminating information where people look for it. Another, yeah, I'll say this later, actually. Well, this is kind of a smaller downside or negative aspect, but when we're working with an article that already exists on Wikipedia, it doesn't work that we just like delete everything that's there, even if you don't like it, because these articles are the result of a community effort. So we need to kind of contribute to what other people have already done. Of course, if anything is wrong or out of date, then that we can remove and change. But we still need to contribute to this community effort and work with what's already there. Another important thing, I was showing you all these very sexy numbers about how many people view health information on Wikipedia or these articles, which is all true. But the kind of impact or metrics work differently from academia. So what you need to know is that if you add your research to Wikipedia, these large numbers of people will look at the Wikipedia article and the information that's there, and they're not going to click through to see the original study. It's going to be a fragment of people who will read the original study. So in a way, the dissemination happens in the article. And what we can measure is how many people look at these articles each day, but we won't know if they read the specific paragraph or sentence that is based on your research. So in a way, this is kind of different from academia. I usually call it a kind of altruistic or blind dissemination. So we know that large numbers of people use Wikipedia for health information, depending on differing on kind of articles, but please don't expect people to read the original papers. So yeah, it's a different metrics. At the same time, for example, if you use altmetrics, altmetrics does add, I forgot, maybe 4 or 2 points to your score if your paper is cited on Wikipedia. Again, it is different from academic metrics. But our long-term goal is that you can mention that you use Wikipedia for dissemination in your application to funding, or in the end, in the kind of metrics of your article. So this is really a long-term goal, that it matters also in academia that you use Wikipedia. So thank you very much for your attention. I hope I didn't rush through too fast through the slides. You can see my email here, but I think I'll be able to send it perhaps after the presentation. Feel free to contact me if you have any ideas, questions, if you're interested in working with Wikipedia, with disseminating your research. And I would be very interested in hearing what are your thoughts and ideas about this topic. Thank you.
Thank you, Adam. That was really interesting. Has anybody got any questions or points just to raise, just to start things off for the discussion? I can't see anything in the chat, but just while people are having a think, I'll just, on your last point there, kind of about the kind of people getting in touch and around the workshops and things, because they sound really interesting, kind of like you say, as a way to update research, but also networking and getting to know the people in your field. Do they kind of come about as people getting in touch with you? We've got this topic, we want to use Wikipedia, or do you kind of put a call out there for people?
No, it's free for all. So if the ARC or any individual researcher or a group contacts me, I'm immediately happy to work with them.
Thank you. Any other questions? I think the second one I had, just on your last point about kind of getting Wikipedia more recognised in grants and kind of the academic world and things. Are the main barriers kind of what you mentioned at the beginning, just like the reliability and free editing and things, or is there any particular barriers?
Well, I'm not sure if it's a barrier. This kind of preconception about Wikipedia really holds in academia, so I'm sure that affects people. But this project is not a central kind of command from NIHR that this is what we need to do. So we are really spreading the word from the bottom. So it just takes time. It's in a way a change of attitudes.
Yeah. Okay. We've got a question from Katerina saying, any thoughts on the Wikiversity pages?
Wikiversity. I didn't interact too much. If I know right, that those are free educational resources that it's a sister project of Wikipedia. I wouldn't be able to tell you more about that. I know about most of the sister projects of Wikipedia, but Wikiversity is kind of out of my sight. But if you have a more specific question, I'm happy to try to answer it.
Thank you. And the second question from Rowena saying, are there any other Wikipedians we can approach for those that are outside the NIHR?
First of all, yes, there are these kind of forums on Wikipedia where you can talk to editors and ask for help. But if your topic is related to health and care, still feel free to contact me, because so basically the minimum requirement for these workshops are that there's some NIHR funded paper included. So, you know, if you find one, then we can also work with other non-NIHR funded papers.
Oh, that's great, thank you. And Rowena's second part of that question was, how do we find Wikipedia editors? But you mentioned forums. Are they? Yeah.
If you go on Wikipedia, I think it's going to say community pages or something, and there you can post questions to Wikipedia editors.
Perfect. Hopefully that's answered your questions there, Rowena. Any other questions from anybody? No, well, we'll share the recording and the slides with everybody that's joined and registered, and obviously Adam's contact details are at the end there, so happy for you to get in touch. And just as a reminder for everyone, all our future Lunch and Learns are on our ARC website, and they're all posted on our YouTube channel as well, so we'll share the links with those in the email. But yeah, last shout for questions, but I think we'll leave it there. Thank you so much, Adam. It's been really interesting.
Thank you very much.
Yeah, I look forward to seeing more work in the future. So thank you. Thank you, everybody, for joining. Bye.
Thank you. Bye-bye.